the ability to diagnose the type of cancer that a patient with CUP has is extremely important. It's changed the whole field of how we manage these patients. Previously, we used to treat most patients with CUP with what we term shotgun therapy. We used one regimen of chemotherapy for all the patients. It could help some patients, but it was clearly inadequate. It wasn't treating the patients specifically for the type of cancer they had, it was treating them all the same. And now we have so many treatments. Some are targeted, precision treatments based on molecular abnormalities in the cancer cells. And it depends first on knowing the type of cancer a patient has before embarking on the specific treatment for their cancer.
CancerTYPE ID is a pioneering and unique diagnostic test that we developed several years ago at Biotheranostics. The test is performed on a patient's tumor tissue, and it looks specifically at the expression of 92 genes to render a molecular diagnosis, which can be used to provide more accuracy to cancer cases that are difficult to diagnose or clinically challenging.
Physicians order or should order the CancerTYPE ID when they are unclear about a single diagnosis in a patient who has metastatic cancer or advanced cancer. If they're uncertain of a single diagnosis, they should order the CancerTYPE ID to help determine the single diagnosis, which would then help determine the appropriate treatment for that individual patient.
The significance of CancerTYPE ID and this level of science is that it provides a higher resolution view of the patient's underlying tumor biology. By providing this increased resolution or molecular portrait of the tumor, it's improving patients' lives by allowing them to have an accurate diagnosis and to enable physicians to feel confident about the therapies that they're selecting for their patients. The other benefit of this test is that it requires very limited material to actually provide that molecular result. And in the era where there's less invasive biopsy methods that are being implemented, this becomes increasingly important.
There's considerable published information showing that this test is about 90% accurate in determining the cancer type, both in those with known cancers, which the known cancer serves as a gold standard to validate the CancerTYPE ID, and in those patients with unknown primary site. Our research program decided to use the CancerTYPE ID starting in 2008 because we felt that it was a superior test for a number of different reasons. The information giving us confidence in the molecular cancer classifier assay CancerTYPE ID comes from thousands of patients who've had the test, its accuracy in known cancer type, the extensive study done in patients with CUP, and the clinical application in prospective studies, in several retrospective studies, where you look back at patients who were treated based on the CancerTYPE ID diagnoses. In the past 4 decades, we've come from not knowing what type of cancer a patient with CUP had, virtually ever, to not having any therapies which helped the overwhelming majority of patients, to an era where we could diagnose some of the patients, treat some of them, but not very many, to a more modern era now where we can diagnose the type of cancer that the patient actually has with specialized pathology and molecular testing. and therefore treat the patients for what they actually have and give them the same prognosis as their cohorts or other patients with known cancers that have spread or metastasized. The goal of oncologists or physicians in general is to help people. When patients present with cancer and we can't determine precisely where it came from or the type it is, it's the goal of their physician to use all available technology that's reasonable to determine what type of cancer an individual patient has.
For my father, what the CancerTYPE ID did, it actually clarified 6-7 months of uncertainty. At the end of the day, no matter where my father went after this moment where he understood that he did not have pancreatic cancer, where the family understood, at the end of the day, we know now what my father went through. Making peace with what your loved one went through is often the most healing thing you can do. I don't know how you would even do that if you don't know what your loved one died of. How could you ever get that closure?